with the course that I'm doing at the moment, which is medical assistance. What I'm personally trying to get out of it is to have confidence in my ability to extend my skills in the treatment room and also at the front desk, and also for the doctors to have confidence in me to fulfil those roles. At the present moment, we've done 3 days and we've had a lot of training, and quite surprised with the impact that it's having on my knowledge and skills. So hopefully you can take that back to the practice and review some of the things that we already do in the practice and perhaps change a few things.
Good morning, my name's Kathy. I graduated from my medical assisting course last year, so that's 2013. Apart from like the medical knowledge, for me it's been a lot about my ability to know that I can do something. So I mean, the content and how much you actually learn is incredible. It is quite a deal of information that they do teach you and that you do learn, but it also gives you confidence, I think, especially for people that aren't very confident and always go, oh, I'd really like to do it, but I'm too scared. So in this, the way they structure the course and the way the girls run it is that you've never ever felt at any time that you weren't capable of doing it. So they're push for you to do well, but then I think because of their support, you did do well.
The major benefits of having a medical assistant, and certainly you can have more than one, we've got 2, are that they increase capacity for the general practice. They allow you a greater flexibility with how things are going day to day. They're a person with the skill set that can move from the treatment room to the front desk, and also provide a lot of assistance in the back room in terms of developing policy and protocols for the practice if it's ever quiet, which is not really something that you see in general practice very often. But when you've got accreditation coming up, having someone who's flexible in these ways means that your practice manager and others have got someone that can assist them during times when the demands of the practice change. So a medical assistant brings a lot of extra flexibility, increased capacity, and greatly enhances the services.
If you're passionate about helping people, which I am, I mean, I used to be a teacher aide for special needs kids, so I guess it's always been a passionate thing to help, and I never thought I'd be able, because I used to vomit at the sight of blood and all that sort of thing now. So I guess if you're really passionate about wanting to learn extra things and using your knowledge and using your skills, it's a fabulous course to do, and the support that you get from these girls is like 110%. They give you that support. And the content of the course, the knowledge, like the things you learn, you're going to have that for the rest of your lives.
I remember one time the medical assistant that we have, who's been much more interested in the front desk and the administrative side of things, but has got that clinical experience, was sitting there, and she saw a patient in the waiting room start to get a droopy face, and the arm started to droop. And she immediately knew that these were signs of an early stroke, and she called a doctor immediately. We were able to commence some treatment immediately, get the patient to hospital very, very quickly. If we didn't have a medical assistant at the front desk who saw that, any other receptionist would not probably have picked it up, and the patient could have sat there for half an hour. So on this occasion, I think it may well have saved that patient's life, certainly greatly improved the outcome. Instead of the person having a devastating stroke, the damage from the stroke was greatly limited by this medical assistant having clinical acumen. I would highly recommend the medical assistant program to any practice that doesn't already have one, and it's really great to sponsor someone within your practice who's keen. They see this as a bit of a reward for their keenness, and they will repay the practice many times over in terms of their extra clinical skills, their extra administrative skills, and a bit of independent thought that they bring with it. They've got more confidence, and all of this is good for the practice and good for the patients.